For former patients, so good morning. Okay, good morning.
Good morning. I'm Mike from Toronto. Had my surgery last Thursday, and I've had zero pain at all since recovery. Like Jeff, I had the same minor discomfort when I woke up. They took care of that within a few minutes. No real comorbidities to worry about, except for my blood pressure, which has been coming down, and that's been great. I've been a little bit nauseous in the last few days, but not to the point of vomiting or anything like that. Like Jeff was saying, I feel like it's stuck up here, and my stomach does backflips now and then when I'm drinking or eating. So, but other than that, I'm fabulous.
And you want to talk about your nerves? You were pretty nervous before surgery.
Yeah, I was extremely nervous before surgery. I'd never had major surgery before, and everybody here was great. I mean, one of the really nice things about the clinic here is everybody who works here has had the surgery. And so, I mean, that sounds funny, but I mean, they're talking from experience, right from the nurse who put my IV in to Sandy and Trish, and then it's everybody's had it, so it's great. I guess the only question I have is I mean, we've spoke a couple times about my pulse rate, which has been pretty high, but I don't think that's unusual just based on how high my blood pressure was before. So.
Well, you can go back and take a blood pressure tablet or two of yours during this kind of recovery period. For patients with high blood pressure, we usually completely resolve their high blood pressure. And similarly for diabetes, our resolution of taking all medicines is over 90, 95, 98%, depending on when we test it. So we expect your blood pressure is going down. But some patients don't get cured of their high blood pressure or their diabetes or whatever, because there are thin people who have high blood pressure and there are thin people who have diabetes.
Right.
But when we take off 100 pounds in somebody, usually those comorbidities get better. So we expect your blood pressure to get better, but it doesn't always happen in the first day. Kind of remarkably, a lot of people, it does get better in the first day, but if it doesn't, it's not the end of the world. And Pam, who put your IV in, she took almost a year for her diabetes to go completely away, because she had almost 5 drugs. She was taking the Byetta, my favorite diabetes drug, which is the one which is derived from the saliva of Gila monsters. So it's like one of my favorite.
Sounds like it's good for you.
It did work for me.
I just think of, they have the TV show Worst Jobs. Can you imagine being the Gila monster wrangler?
The milker.
And once you get him tied down with his 3 legs in the air, then you have to get his saliva. It must be a hard job.
I want to know who thought of that.
Yeah.
Let's test some saliva.
Somebody's sitting there like this going, how about Gila monster saliva?
Yeah, they thought of it because the Gila monsters only eat like twice a year. So they thought, well, how do they regulate their blood sugars? And that's when they started.
Mr. Know-it-all.
I didn't know that. Okay, we should have a little science video.
Yeah. The one other thing I'd probably mention is I know I've read a lot of people have problems stomaching Gatorade after a couple of days of drinking it, and it's tough. And I think I've probably been struggling with not dangerous dehydration, but to the point where I get a headache now and then, and I'm not drinking enough. So drink a lot.
And of course, a reminder for everybody: they do think that I only say to drink Gatorade. Sometimes that's a confusion. Gatorade just happens to be a convenient way to get a little bit of salt in your liquid. So another thing to do is just have water and salt, or water and something salty, or tomato juice, V8. Soup, things like that. All those things will do the same thing. There's nothing special about the Gatorade, and as you say, the sugar in it is often too sweet for a lot of us right after surgery.
And I've been drinking the Aquafina vitamin water, which has about half the sodium of Gatorade. So it's not bad, but it's.
Just remember that water does dilute the sodium in your system, so you have to have salt with the water.
Right. Okay. Good.
Can we take your staples out on camera? Okay. Okay, so he's got a bruise there, and
just a little one.
And that bruise is from moi. He's from Canada, so.
I think that was funny.
Took him a while for the baby to get the joke.
That was also the leaky one, too.
Right. What happens when the ports go in if they're basically like a plastic pen. They look exactly like this pen, except that the company charges $100 for them. And so you just push those through the little cut in the skin, and if they push the blood vessels out of the way, there'll be no bleeding. But if you actually tear through a blood vessel underneath the skin, then it'll bleed and leak for a couple of days. And other than being a bruise on the skin, there's nothing wrong with it, nothing dangerous.
Thank you very much.
All right. Let's see. You want to be on camera?